Good afternoon. My name is Bill Bowman, and for almost 30 years I was a general surgeon in Greensboro. I've changed jobs, but still consider myself a doctor. By way of full disclosure, I also represent the membership of the North Carolina Medical Society as an at-large director on the board of directors. However, the positions of our board and membership, I think, have been very well outlined by Dr. Calloway and Dr. Osbar, and I speak as an individual. I thought that an episode from my experience might help the board in their deliberations about this very important matter. During my 30 years of practice, I had one lawsuit brought against me that had to do with the removal of a rather complicated tumor in a man's neck with a less than perfect outcome, but with the concurrence of a number of very eminent medical experts. Was not my fault that the outcome was as it was. Nevertheless, after about a 2-year period of time, I was sued for $2 million, well above my policy limits for an episode of care. That lawsuit, of course, was very personally troubling as an assault on my good reputation, and a very protracted process began, which took almost 2 years. It was highly costly to me in terms of time spent. Certainly must have been a great deal of cost involved to my malpractice carrier, and I lost a lot of sleep. After about a 2-year period of time, there was out of the blue an offer received to settle the case simply for the legal costs which had been incurred up to that time, with no cash award to be given to the plaintiff. I think that was an obvious no-brainer to my insurance carrier. They placed no pressure on me to settle that suit, but I could certainly see the great relief that was experienced when I agreed to allow that suit to be settled in that way. Personally, I would have rather taken a beating than to continue with that very protracted, unpleasant, and to me, very risky process, knowing as I do what can happen in malpractice cases. Therefore, I think that the North Carolina Medical Board should not rely solely upon the decision and outcome of a malpractice settlement in what I consider to be a flawed legal and insurance process as an indicator of quality of care and decision to post a black mark on a physician's record. Certainly not in a retrospective way. I believe many of my colleagues feel that same way and have been in similar positions. And I want to add my thanks to you for allowing me to speak to you and taking time to listen to me.